This is special COVID-19 coverage on Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal.
And welcome to a very special edition of the Your Health Podcast. I'm your host, Sean McMahon, with continuing COVID-19 coverage. You can always listen and subscribe at CEUSWestCentral.ca/podcast and on all your favorite podcast platforms. Plus, be sure to keep up to date on the very latest COVID-19 information at CEUSWestCentral.ca/COVID-19. Well, with each day that passes, there are more questions and more concerns. It's a complex situation, to say the very least, with countless details that our next guest must weigh and evaluate every moment of every day. Pleased to be joined by the President and CEO of CEUS West Central Montreal, Dr. Lawrence Rosenberg. Dr. Rosenberg, thanks so much for taking the time.
Good afternoon, Sean.
All right, Dr. Rosenberg. So listen, now that we're all feeling the effects of the coronavirus and the impact that it's having on literally all aspects of our lives, people look for comfort at times like this. What words of reassurance, if any, can you give us right now?
Well, there is light at the end of the tunnel. This is not going to go on forever. And in fact, although the number of cases is slowly going up, I believe the numbers aren't going up as quickly as one had thought they might a few weeks ago. So I think that's good news.
Definitely. And I think we'll take all the good news we can at this point, right? There's a lot of information out there, obviously, lots of opinions especially. So I think you'd probably agree, really important for all of us to be getting our guidance from the right sources. So that's why I turn to you, Dr. Rosenberg. What is the single most important piece of advice that you can offer?
Well, I think it's important to realize that individuals have complete control over what happens to them. Meaning that the most important thing people can do is self-isolate, continue to wash your hands as often as possible, and not touch your face. I think anybody who does those three things could feel reassured that they will probably not be affected by the virus.
And just not panic, I suppose, too, right? Because there can easily be a sense of panic in all this, but I think it's important that maybe we try not to do that. That's probably kind of counterproductive, I think.
Well, there's a lot of discussion over what's worse, the hysteria related to the virus or the virus itself. It's debatable.
And listen, COVID-19 testing's been ramping up as well to try to meet the needs of the community. If you could just elaborate for us a little as to what happens if somebody thinks they need to take a COVID-19 test. Walk us through it. What should they do? What should they not do?
Well, if somebody has symptoms or has been in contact with somebody who has symptoms, they can call 811 and request an appointment for testing. The hospital, the Jewish General, will be setting up an expanded facility for evaluating patients in the coming week.
Right. And I guess maybe the other important thing to point out is to not just present yourself to the emergency department at the JGH, but rather, first step, call 811. There's also the other number, too, the 1-877-644-4545. But don't go directly to the ED.
There's no reason to go to the emergency room unless you're really in dire straits. And quite honestly, most people are not in dire straits. Most people have minimal symptoms or no symptoms.
And of course, in calling, you can set up an appointment at our testing center at Cavendish or elsewhere, so that possibility is there as well.
That's correct.
Now, at the moment, and until further notice, this has been a bit of a sensitive issue, understandably. Nobody's allowed to visit patients or residents in any of our CEUS facilities. I'd like to maybe just give you the opportunity to explain why that is so critical right now, that people can't be there.
Well, our most susceptible members of the population are people who are sick, who may be immunocompromised, those in the hospital, and the older population who reside in our long-term care facilities. The only way to protect them is to take self-isolation to the extreme, which is preventing visits. Our responsibility is to keep people safe. We appreciate, we really do, that there are a number of unhappy individuals and unhappy families who may not be able to meet with their loved ones as they did before the pandemic hit. But the upside here is that we are trying to keep your relatives as safe as possible.
I also wanted to ask you about some of the key groups in the community, groups that we've been hearing about in recent days. We're talking about snowbirds, those who gather for religious reasons, and those over the age of 70, along with cancer patients and those living with a chronic illness. What should they know?
Well, what I said previously certainly applies to them. Self-isolation, washing hands, don't touch your face. And For the snowbirds in particular, those who may have come back recently, those are the group that has not been self-isolating themselves as well as they could have, and that's been somewhat problematic.
And if maybe we could just backpedal for a second on the issue of religious groups and gatherings, because, look, Passover is right around the corner, so what we might have done in years past, this year is really not the year for that.
The traditional family Seder with 10 or 20 or 30 or 40 people, that isn't going to happen this year.
Lastly, kind of a personal question. I'm just so curious because the days are long for everybody. There's a lot on everybody's plate. What final thought goes through your mind when your head hits the pillow, at the end of the night, the last few days, few nights?
Well, it's an interesting question because when I finally put my head down, and that doesn't happen very often these days, but two thoughts occur to me. One is what I didn't do during the day that I should have done, and what did I do that I shouldn't have done?
It's a constant battle, isn't it?
It is, but it is a moving target. All this to say that the staff and employees of the CS Centre-Ouest are a remarkable group of people. They're doing a spectacular job, and I think the population needs to be reassured that they've got a united team who's out there for them 24/7.
Dr. Lawrence Rosenberg, President and CEO of CS West Central Montreal, thanks so much for taking the time to join us with such valuable insight on the Your Health podcast. Much appreciated.
Thank you.
You've been listening to special COVID-19 coverage on Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal. Don't forget to subscribe at cswestcentral.ca/podcast or on your favorite podcast platform.